Ladies and gentlemen, it is a great pleasure to be able to pay a special tribute to the men and women who manage and deliver exemplary care for patients up and down the United Kingdom every single day. Much has changed since the NHS was founded 70 years ago, as it turns out, in exactly the same year that I was born. But the dedication and commitment of NHS staff has remained a constant feature throughout. Now, I have long held an interest in the delivery of healthcare from the perspective of treating the whole person rather than just a collection of symptoms. And as Plato observed, the cure of the part should not be attempted without the treatment of the whole. It is now more apparent than ever that such an approach is essential if we are to meet the needs of our aging population and support the growing number of people who are living with a range of long-term conditions. Furthermore, as you all know far better than me, poor health is not something which exists in isolation. Our communities, our lifestyles, the food we eat, the exercise we take, the water we drink, the air we breathe, the quality of our housing and sanitation all play a role, as do the fulfillment of the basic human need for purpose in life, meaningful work as a person and not as part machine, a sense of belonging, dignity, kindness, and self-respect. In practical terms, this means the NHS working with other services, as it does increasingly in the field of social prescription, and supporting people to care for themselves by helping them access the non-clinical services they might need to maintain a healthy lifestyle or improve their mental well-being. Introducing a more integrated approach to healthcare into the community is a pressing challenge for many of you, I know, and integrating healthcare while maintaining the high standards expected of the NHS will require a supreme effort from very special people. Luckily for us, we have more than 1 million of them in the United Kingdom who are up to the task. Healthcare, at the end of the day, is predominantly a person-centered process. We all see the extraordinary dedication and compassion of NH staff at times of tragedy, such as when terrorists struck in Manchester and London last year. However, patients and their families see it every day, as I remember so well when at the age of 13 being rushed in an ambulance on a 4-hour-long journey up the old A4, and in those days there was no M4, from my school near Newbury to Great Ormond Street with an appendix that threatened to burst. I shall never forget the care I received from all the wonderful doctors and nurses. In fact, when the time came to be sent home, I didn't want to leave at all. The NHS really does run on kindness and compassion, and never before has it been so vital. I know, ladies and gentlemen, you face particularly difficult challenges in the years ahead, and that you will discuss many of them this week. But I nevertheless hope you can take great pride in the fact that you deliver a truly caring service, and that during this NHS Confederation annual conference, you can learn from one another, celebrate the past, and plan for the years ahead. I can only offer you my heartfelt thanks for everything that you and your teams are doing in these challenging times. Your devotion to duty and to your patients is an immense tribute to what the NHS means, and I'm sure you will all join me in wishing the NHS a very happy birthday.